Thank you so much for joining us for today's webinar. We are so happy to have Heather Sachs and Jawanda Mast here from National Down Syndrome Congress, as well as Kelly Colzer-Reyes from the California Down Syndrome Advocacy Coalition. Please help me welcome them for this Medicaid Matters presentation. Thank you, ladies, so much for being here.
It's our pleasure. Thanks, Michelle. I'll just go ahead and we'll just do brief introductions. Hi, everyone. I'm Heather Sachs with NDSC. I'm the co-director of policy and advocacy. I'm a parent like many of you. I have a 20-year-old daughter with Down syndrome. We live in Maryland, which is Washington, D.C. area. And gosh, I've been with NDSC since 2017 and doing this work for much longer than that, and have been very active in my local Down syndrome group and our state advocacy coalition as well. So I'm pleased to be here and get this conversation started. Jawanda?
I'm Jawanda Mast. I'm the Grassroots Advocacy Manager for the National Down Syndrome Congress and also mom to Rachel, who is 26 and has Down syndrome. I live in Kansas, in a suburb of Kansas City, Kansas. And like Heather, I've been involved in the community for a very long time. We started out in Memphis and moved here when my daughter was 9. And I've been involved with NDSC for most of Rachel's life, but in a capacity as a consultant running advocacy training boot camp at the NDSC convention for many years. And about 3 years ago, I came on as the grassroots advocacy manager. So I love working with all of you across the country. Kelly.
Hello, everybody. My name is Kelly Colzer-Reyes. I am a co-chair of California Down Syndrome Advocacy Coalition. I also live in California with like the rest of you, except for lovely Jawanda and lovely Heather. I'm in the Bakersfield area. I've been in Kern County for 22 years now. My 13-year-old daughter with Down syndrome brings me to the Down syndrome world and advocacy. I've been involved surprisingly for like 13 years now, since she's 13. With legislative advocacy, because apparently I'm just going to hit the ground running. So that's kind of how we did things there. And I'm just going to mute myself while y'all talk about awesome things that are coming up next. I think, I'm not sure if Jawanda or Heather is first.
Okay, so I'm going to go first. Jawanda, you can go to the next slide. And there will be time for questions at the end. So please either, put them in the chat or hold them. I'm sure there will be a lot of questions and want to make sure that everybody gets the information they need. So, okay, just briefly going through the agenda. I'm going to talk a little bit about NDSC's policy work, sort of our framework and how we, why we take the actions that we take. Talk about the political realities and implications for our policy work and what's going on. Then, the main topic is Medicaid, and we'll talk about what Medicaid is in California. Many of you know it as Medi-Cal. It actually has a different name in every state, further adding to the confusion. We're going to talk about HR 1, which was known as the One Big Beautiful Bill Act, and that passed and became law in early July. So with that, there's going to be key Medicaid changes coming down the pike to Medi-Cal and to all 50 state Medicaid agencies. And in particular, I'm going to talk a bit about work requirements, which were part of this bill and which seem to really be at the forefront of people's minds and anxieties on this. Kelly will jump in and talk about California specific Medicaid things going on and what you can do to help the situation. And of course, Jawanda will talk all things grassroots advocacy, work that you can take and resources that you can access through NDSC on Medicaid, education, and many other issues. So let's get started. Just wanted to talk a little bit about NDSC's policy work. So our goal is to promote the interests of people with Down syndrome, their families, and others who support them. That's it. We don't care what party it is. We are a nonpartisan 501c3 nonprofit. People will say, "Oh, you're a nonprofit. How can you do lobbying?" You absolutely can do some lobbying when you're a 501c3 nonprofit. That'll be the subject of a different presentation. But all groups, including your local groups, can do a small amount of lobbying. And in fact, you should be doing lobbying to further your mission of serving people with Down syndrome. NDSC does not have any kind of political action committee. We don't get involved in elections, endorsements, or campaigns. A lot of other groups, disability groups will, write letters in support of particular candidates or even, congressional or presidential appointees. We don't do that. We are all about policies and not the politicians. We really pride ourselves on working in a bipartisan manner. Honestly, it's becoming increasingly difficult to do so, but we are going to keep chugging along. We have very strong relationships with both Republicans and Democrats in Congress. So we have a bipartisan public policy advisory council, of which Kelly is a member. And these are a group of about 20 folks, very active in the Down syndrome community from across the country. These are sort of experts in different policy areas and, geographically diverse in terms of political perspectives. And we meet with them at least quarterly or more as needed when there are, sticky policy issues that we want to discuss with them and really sort of get their thoughts in formulating a policy position that we can truly say represents the Down syndrome community. And NDSC really is very collaborative. We work in a lot of coalitions. I'd say the ones that we work with most are the Consortium for Constituents with Disabilities, CCD, CPSD, which is the Collaboration to Promote Self-Determination, and the newly formed United Coalition on Down Syndrome, which is a bunch of the national organizations. And, we're trying to find ways to work together and find common ground on certain issues. So with that, let's go to the next slide. And we'll talk about the current political climate. So to no surprise to any of you, there's been, hyper partisanship going on since the beginning of this administration. We see a Republican-led administration, and both chambers of Congress are Republican as well. So when, both chambers and the administration are all run by one party, there tends to be a lot less compromise going on, whether it's the Democrats in control or the Republicans. We really are seeing minimal bipartisan cooperation, especially on the issues of healthcare, education, civil rights, Medicaid. Disability has always been a bipartisan issue. Some of our strongest supporters have been Republicans. Key laws have been passed during various Republican administrations, such as, IDEA and the, Americans with Disabilities Act. Unfortunately, we're not seeing that anymore. We're seeing that, many times disability issues now are getting lumped in with this whole anti-DEI effort that's going on, which is really, really bad for our community and the services that we offer. Just a quick little example of that is we heard, months ago when the administration first took place that they were scrubbing a lot of resources from the Department of Education website that all had the word transition in them, without realizing, I guess, that that encapsulates our folks from ages 14 to 21 and has nothing to do with, gender identity or whatever. So, we're getting caught up in this. Right now, as I'm sure you're aware, there's a government shutdown going on. We are on day 23, which is actually the second largest government shutdown in history. The largest was 35 days. And the main issue that's revolving around is healthcare. And we can talk a little bit about that. But we're also seeing now that courts are increasingly getting involved. The federal agencies, quite honestly, are breaking a lot of laws and bypassing a lot of normal rules. For example, when a federal agency puts out a rule, which essentially would have the effect of law, they're supposed to have a 60 or 90-day notice and comment period for the public to weigh in on that. This administration is just pretty much bypassing that entirely. And so they're making a lot of changes without stakeholder input, which is very, very concerning. We are all for improving systems. We know that Medicaid and education and, these systems are very flawed. There's a lot of improvement that can be done. But what we're seeing now is everything is being burned down to the ground, which is really bad and setting our community back many, many years. Let's go to the next slide. I think I just talked about the major restructuring too of federal agencies. For those of us following NDSC's social media and are getting our information as part of our National Down Syndrome Advocacy Coalition, you've probably seen that we've really been one of the leading organizations in this effort to get the recent massive firings in the Department of Education overturned. That's a totally different presentation, but we're happy to share some resources about why these mass terminations are really, really bad for our students, particularly for IDEA implementation. And like I said, we're seeing a lot of deregulation as well. For example, in the end of the Biden administration, they had passed regulations basically outlawing, phasing out Section 14C, which is the subminimum wage. Well, this new administration came in and just automatically negated that. So as of now, subminimum wage is still legal at the federal level in certain ways. And so a lot of the gains that we've made are just being undone with a stroke of a pen, which is very frustrating. Let's go to the next slide. So what the result is that we're playing defense in many areas. And it's honestly like a game of whack-a-mole, where as soon as we can, tamp something down, something else pops up. I think that's honestly part of the strategy. We're seeing a lot of, fatigue of advocates, but we've got to keep pushing and, keep sharing our stories. And Jawanda's going to talk more about the importance of that, as well as the importance of state advocacy. You've probably heard the terms, we're throwing it to the states, we're giving it to the states, whether they're talking about education or Medicaid or what. And that makes state level advocacy much, much more important. So there's a lot that you all can do in California, and Kelly's going to talk a little bit about that. So let's get into Medicaid. Okay. So Medicaid truly is a lifeline for people with disabilities. Next slide, Jawanda, we can get a chance. It covers 83 million people, huge amount, provides health care, but it's also more than just medical care. It covers vital home and community-based services, HCBS. And for those of you that are not yet in that adult world of HCBS, those are essentially the services that enable adults with disabilities to live, work, and thrive in the community. So HCBS can be anything ranging from a personal care attendant that comes to their home and helps them get ready for work, a visiting nurse so they don't have to go to the hospital to get their infusions or whatever they need, job coaching and supports. In many states, transportation to your job is covered. It just depends on what's covered in one state. But those home and community-based services are very, very critical. And unfortunately, as I will explain in a little bit, those are really one of the first things that are going to be on the chopping block that you're really going to have to fight to maintain at the state level. As I said, there are different names for Medicaid in different states, and they all have what's called a waiver program. Now, what is a waiver? We've all heard, okay, my kid's on the waiver, or we have a lot of states have very long wait lists for waiver services. These are those home and community-based services. And essentially, a waiver is a person waiving their right to receive services in an institution. These laws are all very, very old, and they were developed back when most people with disabilities were put in institutions. And so there actually is a right for the state to pay for services for each person, but that only extends to an institution. So which is a congregate segregated setting. So what we've seen over the last couple of decades is states doing something different, applying for waivers from this requirement to essentially institutionalize folks. And that's where we get these these optional waiver services that are provided in the community. Something else that people don't realize is that Medicaid provides millions and millions of dollars to schools around the country for services like early intervention, habilitative services, that's different therapies, speech therapy, a lot of mental health supports, etc. And so those funds are very much in jeopardy now as well. You may hear something called the federal share, the FMAP, which is super wonky. I'm not going to get into it, but basically what you need to know is that Medicaid is currently a federal state partnership, and the federal government provides about 50 to 75% of the Medicaid funding for a particular state, and then the state provides the rest. And so this is typically based on need. There's some really complicated formulas, but now, as I'll talk about in a minute, we're going to be seeing massive, massive cuts. The federal government is going to be providing much less of their share, leaving it up to the states to make up the gaps, which is very problematic because, as we know, state budgets are already crunched. And in order to do that, they're going to have to cut certain services. So what are they going to cut? Let's go to the next slide. So it's hard to answer that question, but I can tell you what they are not going to cut. And under the Center for Medicaid and Medicare Services, which is the federal agency located within the Department of Health and Human Services that oversees the entire Medicaid program, there are two categories of benefits that can be offered through state Medicaid programs. There are mandatory benefits and there are optional benefits. And mandatory benefits are absolute requirements for states to cover. In order to get their federal funding share, they have to cover certain benefits such as hospital and doctor visits, labs and x-rays, nursing home care, early periodic screening and diagnostic testing for children under 21. That's that pathway to early intervention services that we often see. And there are some other things listed as well. The link is at the bottom of the slide. Now, there are a lot of optional benefits, and these are things that states may cover, and I'm not sure what it is in California, but it does really vary from state to state as to what is covered by your waiver funds and how you can use them. And not just waiver funds, but also the healthcare component of Medicaid as well. So for example, things like prescription drugs, dental and vision insurance are actually optional. There's a lot of states that do not offer that. And same thing with mental health supports. Assistive technology is something that folks frequently want to use Medicaid funds for, but it's only it's only covered in certain states. And as I said before, there's a whole list of, examples of other optional benefits that states are covering. So home and community-based services are optional, but we know that they are absolutely critical for people with disabilities to live independently or whatever supports they need to be in a community setting rather than in an institution. And the states get to decide, and they're still going to get to decide within that optional benefit framework of what to cover and who qualifies. And it's not just, so we're going to see changes in eligibility to that, where, maybe certain people that would have been qualified are no longer going to be qualified. We're going to see changes in the types of services that the state covers and the amount that they cover. So for example, now if they're fully covering dental, maybe they'll be covering it at 50% or something, and then folks will still have that additional funding gap to make up. So a lot of changes ahead. But just wanted to sort of make that distinction for you between mandatory and optional benefits, because it's that optional benefit category that you really are going to have to advocate for on the state level. Let's go to the next slide and talk about HR 1. Which I will not be referring to as the Big Beautiful Bill Act, because it is not beautiful for people with disabilities. It was signed into law on July 4th, 2025. There was a lot of advocacy from, the wide disability community, as well as other, civil rights, healthcare, et cetera, communities in the Medicaid arena. And it really was a partial advocacy success in that the initial proposals that Congress was trying to get through would have made horrible changes to the Medicaid program. For example, the biggest change being block grants, which they were trying to do, which would mean that each state would just get a fixed amount of money regardless of need with absolutely no flexibility. So you get a certain amount of money. Doesn't matter if you have an influx of new people moving into your state who need to get on Medicaid, or if, people are the birth rate is increasing and you have more infants and toddlers with disabilities that need Medicaid services. Under a block grant program, the state is stuck with whatever it gets from the federal level, and then again has to make up the gap. So kudos to the community for stopping that. And there were some positive provisions in HR 1. And again, I'm talking about just from a Medicaid perspective. So the bill is very all-encompassing. There are changes to other programs across the country with that, and I encourage you to take a look at that. So as I said, some positive provisions. It does provide some funding for HCBS expansion because it acknowledges that with this bill, probably states are going to be cutting home and community-based services. So it was kind of like, okay, we'll throw a little bone to the disability community and recognize that home and community-based supports are important, and we're going to provide a little bit of funding to the states for that. The amount of funding is not significant, and the federal government has already imposed big time barriers on how this funding can be used. For example, it came out and said this funding cannot be used for employment supports programs, which I'm not sure why they did that, but there's a little bit of funding available. One very positive thing that was attached to HR 1 that passed was the Enable Act, and that made permanent in law the able to work, able rollover, and able tax savers credit bills. So hopefully many of you have able accounts for your loved ones. The whole community fought very, very hard to get able passed. It passed back in 2014 under President Obama, and then there have been several improvements to it made since then. And so this codifies some of the improvements that were made to that. I'm happy to give additional information at some other point. Something you should note too is even though HR 1 is law, there is a pretty long rollout period for changes over the next 10 years. So everything that I'm talking about now is not all happening at once. So there's plenty of time to advocate and try to stop things or try to make them less bad. Another thing is that HR 1 makes distinctions between people on the traditional Medicaid pathway and the Medicaid expansion population. So most people with Down syndrome are on Medicaid through the traditional Medicaid pathway. That means you're very low income and you have a marked and severe, functional limitation, a very significant disability that essentially qualifies you for SSI, Social Security, and then that's often the gateway to get on Medicaid. During the Obama years, when Obamacare came into play and the Affordable Health Care Act was passed, there were a lot more people pulled into the Medicaid program. And this is called the Medicaid expansion population. And those basically are folks that didn't have health insurance and, that had very low assets and were poor, maybe not to the extent of folks on the traditional Medicaid pathway. There are a lot of people with disabilities in the Medicaid expansion population, maybe not Down syndrome, but, other types of disabilities. And so those folks are, when I talk now about certain changes happening for the Medicaid expansion population, it will be affecting people with disabilities, though maybe not that many people with Down syndrome specifically. Who else is in the Medicaid expansion population? There's data that shows that over 70% of direct support professionals, so those are DSPs, those are the folks that support adults with disabilities in the community. So the job coach, the person coming in and providing personal care supports for you, those folks are on Medicaid themselves because those are very low paying jobs typically, and most of those folks are in this Medicaid expansion population. So let's go to the next slide and talk about some of the changes and potential consequences this is going to have. So when HR 1 passed, it passed with the largest cut to Medicaid funding in history. It had a total reduction $930 billion in Medicaid federal spending over the next decade. So remember, we talked about the federal state partnership. Well, there's much, much less money now at the federal level for Medicaid to be distributed to the states. So that's going to have a significant impact. People will often say, oh, well, you know, our Medicaid's not going to be affected. Every single state Medicaid program is going to be impacted by this because they're going to have a lot less funding from the federal government. Another noteworthy change in this bill were the imposition of work requirements, and I will definitely talk more about that later. But this completely changes the Medicaid system in that adults who are under 65 who do not meet an exemption, and I will talk about the exemptions, they are going to have to work, volunteer, or be enrolled in school 80 hours a month. They're going to have to somehow register that they're doing this on whatever Medicaid system the state is developing. So, you know, file a lot more paperwork, and this is directly tied to coverage. So you don't file something right, you're not, you know, able to work that 80 hours a month, you lose your Medicaid, which then obviously is a whole snowball effect, because how can you go out and get a job and be supported at a job if you don't have your health, if you're not, you know, if you're not getting the supports like job coaches that you need? It's very problematic. We've also seen in this bill that there's going to be a much stricter what's called redeterminations. Many of you with adults on Medicaid may have gone through this already. It typically happens annually, where, you know, essentially I have to reprove that my daughter has Down syndrome once a year, which is very frustrating as it is. Well, with the passage of this bill for the Medicaid expansion population, they are going to have to prove their eligibility every 6 months. So again, this is really going to create a paperwork nightmare for everyone. And it's particularly going to hit our direct support professionals and caregivers hard, since they're on Medicaid themselves and are going to have to comply with this. Let's go to the next slide. All right, so some other noteworthy changes to Medicaid, and these are just really some highlights that I pulled for you guys because I don't want to get, you know, too in the weeds. But one change which is noteworthy for our Down syndrome community is that this bill made significant cuts to retroactive coverage. So what does that mean? For our community, for example, a young couple has a baby with Down syndrome, and as we all, those of us who are parents know, months are really a whirlwind. You're dealing with a diagnosis, whether it's expected or a surprise, and you're seeing a ton of specialists and trying to get a handle on, you know, many. So the way the system works now is folks have 90 days from, you know, in that example, the birth of their child, to apply for Medicaid for that child. And when it is approved, it's retroactive. So then it goes back to the child's birth date, and it would cover then all of the medical services that that child is receiving. So the family is not starting off in medical debt. The change that HR 1 has made, initially they took out all retroactive coverage, and then they changed it to 30 days. And again, because of advocacy, they settled on a compromise, which is that the traditional Medicaid population will get 60 days, so 2 months, to file for Medicaid. And it's been eliminated then for the non-traditional Medicaid, for the Medicaid expansion population. So as I said, there is, you know, a risk of major medical debt for folks. And, you know, something that you can do as, you know, a local group is just, you know, make sure that your local hospitals and doctors' offices have knowledge of this and are able to encourage and walk new families through the process of signing up for Medicaid as soon as possible, because now they only have a 2-month window to do that. We're also seeing, you know, changes in home and community-based services. There's language in the bill that talks about encouraging states to shift to self-direction and managed care. Hey, that's all great in a vacuum, but without the funding and services, that's you know, essentially just going to be on paper. The workforce instability that's going to be caused, you know, with the direct support providers getting caught up in this, is going to be very problematic. And the states, the bill has also limited essentially essentially the amount of money that the state can charge providers for certain things, and that the amount of money that the state can tax providers. So this would have been a way for states to make up funding gaps. And when I talk about providers, I'm not talking about the, small, provider down the street. I'm talking about, large healthcare systems, Kaiser or, that type of stuff. Those are considered providers, and it would have kind of been a natural thing then for states to increase their taxes on those providers, but the providers managed to push back against it, and that's going to be one of the changes that's going to be made over the next 10 years, where states are not going to be able to do that to get extra funding. Let's go to the next slide. Okay, a little bit about work requirements, which in the bill are actually called community engagement requirements. So as I explained before, states now, and not yet, I'll talk about the timeline in a minute, but basically starting January 1st, 2027, states are required to tie work to Medicaid. So I'm going to take a pause and allay some fears, because I've been getting this question from so many different people in the community. Work requirements are limited to the Medicaid expansion population. So our folks with Down syndrome, who we all know are very capable of working and, do a great job in the community, they are not going to be, for the most part, they are not going to be held to these work requirements. They would fall within an exemption to them. And I listed some exemptions below. Our folks would likely fall under individuals who are medically frail. Part of the problem is a lot of these terms were put in the bill and nothing was defined or tied to definitions in current statute. So what we're essentially waiting for is by June of 2026, the Department of Health and Human Services has to come out with what's called proposed regulations and guidance to describe essentially how this bill can and should be implemented. And one of those questions will be, well, who exactly fits into these categories of exemptions? But I'm very confident that, people with Down syndrome will, for the most part, fall into the exemption category. However, just because they fall into the exemption category and, do not necessarily need to meet these 80 hours a month work requirements does not mean that they're not going to have to file paperwork to prove their exemption. And so states are in the process right now of quickly trying to develop their systems. For example, one thing that we're trying to advocate for is, sort of an automatic exemption for folks. If you're already, deemed qualified and receiving SSI, so you meet that level of disability to get SSI, you should be automatically exempt from having to file paperwork to prove that. And the reason why is because with the filing of paperwork, that is when people lose Medicaid. There have been many, many examples of this around the country, and I'll talk about it in a little bit. But even folks with Down syndrome, even our families are going to get caught up in this paperwork nightmare, and there's going to be a lot of eligible people inadvertently kicked off of Medicaid and then have to kind of go through the whole rigmarole to get back onto Medicaid. Let's go to the next slide. So what actually happens with work requirements? There have been several states that have already tried this in recent history. The data is very clear. Employment does absolutely not increase. And in fact, it's the reverse. These reporting systems that were put in place, and in particular, it was in the most recent was in Arkansas. New Hampshire and Michigan had already tried this, and there were court cases, and they were forced to end their programs because they were deemed illegal. So in Arkansas, what happened was in the first 7 months, over 18,000 eligible people lost their coverage. And that's completely due to failures to file paperwork or failures to do it correctly. A lot of the paperwork systems were inaccessible. You had large rural populations in Arkansas. And, for example, there was no way to do this by paper. So you had to have a steady internet and a computer in order to file that. And a lot of folks lost their coverage. We're going to see, as I said, more paperwork and administrative burdens with the 6-month redeterminations for the Medicaid expansion population as well. States must do this, must have these systems in place by January 1st, 2027. That is very close in time. And so, what's happening now is their state legislatures are meeting. If they're not meeting yet, they're probably meeting January, top of the year. And suddenly now they're going to have to allocate funding, not just to make up the payment, the lack of payment from the federal government in Medicaid to sustain the state Medicaid program, but they're now going to have to earmark massive funds to do a very quick and comprehensive revamp of their Medicaid systems and the way these things are tracked and recorded. So that's a huge problem for the states. Let's go to the next slide. Okay, so the timing of key provisions, just certain things to look out for. As I said, by June 1st, 2026, HHM must issue this interim final rule with requirements of how to implement that. This is tough because, as I said, states are meeting right now and in their legislatures, and they're trying to essentially fly the plane while building it. They're trying to, allocate money and design these systems, but without the HHS rules, they're having a difficult time because they may have to go back and redo certain things that have been put in place. By December 31st or then, January 1st, all states have to have work requirements in place. There is an exception if, states show that they've made substantial progress toward this, et cetera, they can apply for a 1-year exemption. And I definitely anticipate that many states will do that. In 2027, the work requirements, which initially will just be for certain populations, will expand to additional populations. And again, this is going to be defined by HHS. For example, for our purposes, one population that is not currently covered by the exemptions that we certainly hope will be covered are adults with dependent children over age 14. So, you're a caregiver to your adult son or daughter with Down syndrome. If your family is on Medicaid, then you're going to have to go to work and, document that 80 hours a week as well. And then we're going to see later on in, the 10-year span, these, provider cap reductions and, inability to increase state taxes on providers, et cetera, et cetera. So, with all of that, state advocacy becomes more important than ever. This is all happening at the state level. The changes that we can make now are at the state level, and I'm going to turn it over to Kelly to tell you what's going on in California and how you guys can help.
Oh, thank you so much, Heather. That was not overwhelming at all, right, guys? That was awesome. Perfect. So, friends, in California, Medicaid is Medi-Cal, right? But Medi-Cal is not just health insurance. It's not just health care. For example, in my family, we have the Medicaid waiver that we use here is the HCBS DD waiver, which we call in California the institutional deeming waiver. In order to have a service like IHSS, which I bet a lot of us have, right? Because it's one of the services that we use often in the state of California, you have to have the Medi-Cal waiver as you have to have Medi-Cal in order to qualify for IHSS. So all these pieces are connected to each other. So Medicaid funds help us with healthcare and secondary coverage and copays and pharmaceutical stuff, right? Like our prescriptions. It also works on CCS, the California Children's Services. It also works on in-home supportive services. It also helps us fund our IEP services at our schools, our school-based healthcare and screenings at our schools, and our regional center system. Yes, we have the Lanterman Act, and yes, we have California funding that's directly allocated and legally required for Lanterman services. That's the whole regional center system. I bet is everybody here connected with the regional center system? Can you do me like a little favor and say high five, react, something, so I can tell, yes, I'm a regional center client, or I have a loved one who is supported by the regional center in some way. Excellent. Thank you, friends. That really helps because that's one of those systems that you is also utilizing Medicaid funding. Good, you are too. Okay, so our family is served by Kern Regional Center. I bet here we've got East Bay, and we probably have Golden Gate, and we might have North Bay. Like all of these different regional centers use Medicaid funding. So remember, I don't know if some of us I was lucky enough to come into the last fiscal crisis with my loved one with Down syndrome. We had no social rec funding at that time. They finally restarted that a couple years ago. Those kinds of fundings are like when they have a fiscal crisis, they cut something. They have to cut something to make the funding up. Self-determination program. How many of us are using that kind of program right now? Is it just me? Oh, I'm the only one with self-determination. Okay, so maybe if you're just straight regional center, maybe it'll be a little bit less horrible, but that's one of those HCBS waivers also. So we've got the home and community-based services waivers, the self-determination program. All those pieces are partially or like 50% funded with those Medicaid dollars. And I just want to make sure you guys have if you're not familiar with the HCBS DD waiver, Undivided, which is based in SoCal, but they also have a lot of Northern California families that they're supporting. They have some exceptional explanations, and that is a live link if they have access to that. I can put it in the chat later, but they have great explanations of what is this waiver? How does it impact our lives? And those kinds of resources all over their website. So if you go to undivided.io, they're a wonderful partner with California Down Syndrome Advocacy Coalition here in California. And they do all kinds of educational videos and webinars and things like that we can get connected with all the time. So make sure you check that one out. Could you go to the next slide for me, please, Juwanda? One of the things that's been happening recently is people are receiving a new letter from the Department of Healthcare or DHCS, right? So people are getting these letters. I would like to make sure everybody knows to not panic. These are letters for the entire Medi-Cal system. They are saying that our assets are now, this is a California law, not a federal law, but this is a new thing that people are starting to receive. That the Medi-Cal letters, that we're going to be looking at people's assets starting at the beginning of January 26. This is not the Medi-Cal institutional deeming waiver, the HCBS DD waiver, but it does not say that on the letter. So one of the things I think we're going to be seeing over time here is how we're going to impact not necessarily eligibility, but people falling off the system because of confusion and misinformation. We need to be really active and careful that we're paying attention to what is changing at the federal level and then how is it impacting California. So the HCBS DD waiver is in place as it is until 2027. Now, there are two things that we've got coming up for the HCBS waivers that Heather was talking about earlier that we need to be careful for in California. We've got two programs that need to be renewed soon. One is the self-determination program. That's our HCBS self-determination program, and that's 2026. This summer, coming summer is going to be renewed. And then the institutional deeming waiver, that will be in 2027. So as those pieces come up, or those are something perhaps that you're passionate about, connect with us at California Down Syndrome Advocacy Coalition so we can work together to be more effective and not have to reinvent the wheel. We can work on those supports and try to salvage what we've got, because we've got some pretty amazing programs in California. They're a little overly complicated, but we have things that we don't have in other states, and we would like to keep it that way. We want to keep the amazing programs that we have. We're not trying to make more programs. We just want to make sure, like, status quo right now. Let's keep it, make sure it's working well, and make sure nobody wants fraud. We all want to reduce bad stuff. We want more good stuff in California. So we want to keep going with that. Joanna, could you go to the next slide for me? I think this is my last one. So these are some of the things that we work on at California Down Syndrome Advocacy Coalition. It's really important to keep this in mind. We are grassroots. We aren't even officially like a 501c3 or anything. We are basically a whole bunch of Down syndrome organizations getting together around the state to disseminate information and to work on letters that we can work collaboratively statewide so that we've got an open communication. So we don't have a budget. We're just trying really hard to make sure that we are connecting to as many places in California cross disability, but then also connecting to those Down syndrome organizations, because we recognize A lot of our families are connected to Down syndrome organizations before they're connected to cross disability organizations, especially early on. So we're focused on building relationships around the state. We are policy, not politics, just like National Down Syndrome Congress is. We are not interested, like I happen to live in a Republican-led district. Our other co-chair, who you may know, Kathleen Small, up in the Sacramento area, is she's in a Democrat-led district. We're just happy to work together and make sure that all of the things that we're working on are in the best interest of all individuals with Down syndrome and other disabilities. So we've got focus on our policy. We've got representation around the state. We're trying really hard to get all 52 congressional districts representation like documented. So if you know that you would like to get more involved, you are welcome to send me a note. I will, after we're done talking here while Jawanda's chatting, I will share my information in the chat for you, and just reach out and we can get connected and make sure everyone's able to plug in their own personal stories and share those with their congressional representatives, their assembly members, their state senate senators, all of those people who really need to be hearing from us right now, whether they're doing great things or they're doing hard, like not great things, things you may agree with, things you may disagree with. When they do great things, you want to send them thank you notes. And when they do things that you'd like them to modify, you want to send them that feedback, because regardless of your party, their party, our party affiliation, regardless of all of that, they work for us. They don't have a job unless we vote them in. And last I checked, we are still a democracy. So there we go. California programs that are connected that we work on a lot. We've got people who are actively trying to ensure that we're solid, are the self-determination program. That's mostly Kelly, because that's my favorite thing. The regional center system, we're working on housing. We've got a whole bunch of parents of adults and adults with Down syndrome. We're trying to increase that number. We mostly are parents at this point. Working on housing. We've got a colleague out in Santa Barbara who's got a housing organization, and she is working on that with another family down at Down Syndrome Association of Orange County, and they want to be working on fixing housing. We know that we're in a housing crisis in California. It's just exacerbated for people with disabilities. There is just really difficult situation. We're working on employment and education, and add your favorite, whatever your unnamed area is, and join us, and we can work on those things together. Just so you guys know, those of us who are working on it typically are connected with at least one Down syndrome organization, but you don't have to be. And we are also, like, I served you all for the past year and a half on California's master plan for developmental disabilities. So I get to volunteer for the next 10 years. Twice a year, I get to drive to Sacramento from Bakersfield to represent our community. So at least we have a seat at the table, right? We're part of those conversations. I'm also a community college professor. I teach at Taft College in the Central Valley, and we have a disability services program. So those little, like, not everybody's going to call their representative. Sometimes your advocacy is, what am I doing right now, and how do I tweak it so that it's meaningful in both ways. So I can spend my time at work. For example, right now, I'm here talking to you about what you could be doing, and I'm working, right? Like, I just, like, how can you maximize your time? We are all busy. We all need to have that armchair advocacy ability, right? Like, give me the one thing I can do. That's like all I can do this week. But those kinds of things are there. Cindy Liu is another one of our active members. She was just appointed to the ARC of California. We've got people who are on their board. So we've got people like kind of sprinkled around, and the more we have connections cross disability, the more successful we're going to be at making sure people know that we're out there, that we're real, that we're people, and that our families matter. So those are some of the California things that are happening right now. I will be here until the end with the others, and I know we're taking questions at the end, but if you do have some, or you want to connect later, please let me know. Jawanda, it's up to you now.
Thank you, Kelly. Michelle, do we have a hard stop on the hour?
No, ma'am, I put a buffer in case people can still hang out and have questions. So we have about a 30-minute buffer.
Okay, but do you need us to end the slides by the hour?
No, not
Okay.
necessarily, no.
I'm gonna just, well, I think I am in Kelly's slide. I'm gonna real quickly go over state advocacy a little bit just to kind of piggyback on what Kelly said. You all in California are just so fortunate to have Kelly because, and the California Down Syndrome Advocacy Coalition, because you've got some really smart, talented women leading that group, and there are certainly men involved, but we work a lot with Kelly and Kathleen and Cindy Lou, identifying people who can be, get us connections to representatives or when we get calls about different things. So you all are very fortunate, and I hope that you will plug in with Kelly and the California Down Syndrome Advocacy Coalition. The thing is, you can do as little or as much as you want. And that's going to be true about most of what I talk about. But Heather mentioned, and one of the reasons we wanted Kelly on here was because we are in California. But we believe that we're going to be pivoting with our advocacy to more state level advocacy because more things are going to be decided at the state level. So, just some of the things that you can do are to influence the state budget is to build a relationship with the legislator and their staff. And I'm going to talk a little bit more about that in just a few minutes. Reach out to people and push Medicaid to be a state funding priority, which in California, I call it an entitlement, but you still have to have funds and you still have to have providers. I mean, you may qualify for something, but if there's no provider to provide the service, you're still in trouble. And advocate for general funds to fill those federal funding gaps, which is going to be a big thing. And it's going to be a hard thing because state budgets are tight too. Something a lot of people do to kind of get involved is testify at hearings and submit public comments. That's something that I bet Kelly and them would help you with. And we have some things on our website to help you know how to testify. And if you think you would be too terrified to get up and testify, you can always submit written comments, and there are different people that help you with that. But Kelly talked a lot talked about some of the state level stuff, so I'm not going to camp as much on that. And I am going to tell you that there are some things on our website to help you with your state level advocacy, but you want to try to safeguard eligibility and access. So you want to work with your agencies to track disenrollments and find out, are they truly falling off? Do they truly not need this anymore, or did they fall off by accident, or they fall through the cracks? You want to work with them to make sure that you're addressing where these errors come in. Engage in the process on the state level. Kelly's already talked about joint advisory groups, review state plans, amendments. I already talked about submitting comments and monitor and respond to federal rulemaking. And again, these are things that we can help you with and Kelly can help you with. And the way you learn about these things is signing up for these different resources from different agencies and organizations on the state level, on the local level. I don't know, Kelly could tell us, or you all could tell us, you probably get some things to your regional centers too. One of the things that we're trying to gently remind people of, and we want to remind you of, and you tell your friends, you want to keep all copies of correspondence with anything related to Medicaid and Medicare, HCBS or other waivers, SSI or SSDI. And you want to print your materials from your online accounts. The reason we're telling you to keep these records is should you fall through the cracks or should your person, have an issue, it may make it easier to be able to backtrack and say, see, I did this and see, this is what we were getting without having to start over. So that's not real. That's just something that we think is a good little reminder for everyone. The federal and state government control different things. State and local governments generally help control Medicaid eligibility. I'm not going to read all this to you all because I want to give us time for questions. I'm just going to mention the subheadings because I've got a few slides to run through. But local and government controls usually health and services like Medicaid eligibility, waivers, blah, blah, blah. Education, like early intervention, special ed staffing and services, preschool and transition supports, discipline and accommodations, disability rights and daily life. I hope that that some of you are working with your disability rights organization there in the state of California. Right now, under federal law, every state has to have a protection and advocacy agency, and in most states that they are called disability rights. And they do a lot of work on these topics that are listed here. In my state, they've done a lot of work on seclusion and restraint, and I've worked together with them on that to get stronger seclusion and restraint regulations in the state of Kansas. And then transportation and inclusion. Most of the time, transportation does fall to local or county agencies to work together to try to provide that, the same with transit, with accessibility kind of thing. So that just kind of tells you a few of the things that may be controlled at the local and state level. I'm having trouble getting my thing to move. There we go. The benefits of state and local level advocacy is that states usually do move more quickly. State legislatures tend to meet every year, but for shorter periods. Kelly, what does the state legislature look like in California? I don't remember.
We have the makeup. We have an assembly and a state senate.
No, how often do they meet?
It seems like they're always meeting. They're full-time all the time. They love meeting all the time.
Right. So is their session supposed to be for a year? Or is it every other year? Is it part of the year?
Oh, no, it's every year.
For the full year, or just part of the year?
I can check. I don't remember.
Okay.
I just know that when they need to go testify, it takes me 5 hours to drive there.
Okay. And like in Kansas, our legislature meets every year.
Right?
In Kansas, our legislature meets every year, but it's only for a few months, and then they have to call a special session. There's some states that only meets every other year. So Kelly's going to track that down to find out for sure. I would have assumed that California's met every year and for a longer time because you're a very large state. You have better access to state level legislators. You may run into them in the grocery store. You may run into your U.S. representative in the grocery store, but it's more likely it's going to be a state or local level person. States actually implement waivers, special education, employment services, so they decide what those services are going to look like. I'm going to use an example from Kansas. In Kansas, our home and community-based waiver does not provide for transportation, which makes me crazy because how do you think people are going to get to work if they don't have transportation? Some states do provide transportation. So that just shows you there's a difference that states make different choices for what works for them, and you can have more impact on that. And states can also provide protection against federal rollbacks. They can expand rights beyond the minimum standards for a state. For state and local level advocacy, any level advocacy. And Mary, I see your hand, and let me finish the slide and I'm going to get to you unless Michelle wants us to wait completely till the end. This is what you're going to hear from me over and over again. And I work with our grassroots advocates across the country. And I tell people that I get to teach people how to tell their stories to impact change for people with disabilities. And I think it's the best job ever. And that's what we do on all levels. You want to tell your story. You want to stay nonpartisan and professional as much as possible. Your story is what's going to make a difference. I was asked on a podcast yesterday why stories are important. Well, stories make you feel like they help create empathy, and they make you feel like you know a person. In my situation, I have a 26-year-old daughter with Down syndrome. So people who love Rachel that may be against a policy that is helpful to Rachel, when they understand how that's going to impact her, they are from the story about her and how it'll impact her, are going to be much more likely to embrace that. And I have seen that happen over and over again in her life with people we know and also with elected officials. Engage. And you know what? federal legislators, state legislators, they will all tell you over and over again, the best thing you can do is come and tell them your personal story. You don't have to go to Sacramento or Washington, D.C. to do that. You can do that by reaching out to them to local offices or sending them emails. And we have examples of all of those things on our website, which I'm going to give you a link to towards the end. And Michelle's going to send you these slides. I'm going to send them to her and she's going to send them to y'all. But on the state level, you know, one thing that happened with me, my daughter was restrained. It was a bizarre story that I won't go into, but I was invited to come, when I reached out for help from someone, I was invited to come and testify. And that's kind of how I got started testifying at hearings. And they like my Southern accent in Kansas, so they love for me to come and testify at things. So I started getting invited to come and testify at lots of things on lots of topics. But engage in those state legislative sessions and your local sessions, like your school board or your county services, or how, I'm not exactly sure how it's set up in California. Organize advocacy days at your state capital. That is one of the things that is most empowering and fun too for our families, is when they go to advocacy days at the state capitol, whether that is with others from other disability groups or just the Down syndrome community. There's absolutely power in both of those. Very important for you to always be empowering other families and self-advocates to speak out. And I try as much as I possibly can to have a self-advocate with me when I'm visiting with a legislator. It doesn't always work that way, and if it doesn't, I'm always sure to take what we call a one-pager from a self-advocate. But as much as we can, we need people who are living this experience to be able to speak for themselves. And I don't mean with their physical voice. They may use an augmentative communication device, or they may write something, or they may have a poster with pictures on it. However someone communicates, that's what we're talking about when we say speak out. You can also use social media to impact lawmakers and other public officials, community leaders, town halls. I'm just going to warn you to be really careful with social media. I've noticed, especially in the last few weeks, people really attacking elected officials when they've done something good and they post about it, and then the advocates, the families, post really ugly comments about how, well, you didn't do this though. Well, you know, we don't really have time to camp on the things they didn't do, because we're too busy trying to pass good policies for people with disabilities. So trying to focus on the good and move on is probably a better way to handle that. Watch budgets. I have a friend in North Dakota who says follow the money, and that's how you learn about disability policy and where you need to do your advocating. And certainly watching those budgets and waivers is going to help with that. Advocate for state funding. We've already talked about that, for services that may be cut on the federal level. Serve on task force, work groups, or advisory committees. I was that starts maybe even at your local school system, being PTA, PTO, whatever you have, getting invited to be, if you possibly can make the time and you get invited to be like on a district special education committee, do that. You are going to make a lot of contacts. It's going to help you and your child or your person, but you're also going to be able to make a difference in the bigger scheme of things too. There are work groups, advisory committees, and they do take time, and you may not be able to do it. And if you can't do it, try to find somebody else that can represent the disability community. What I found when I moved here was that people with disabilities weren't really being represented at our local school. I told this story last night. In fact, I went to this PTO meeting and they gave gift cards to the teachers, but they didn't give one to the special ed or resource teacher. And I was like, what's that about? So we got that changed. And the resource teacher told me, she said, Juwanda, before you came, we didn't get that. I shouldn't have had to do that, but we need our voices to make sure those things are getting taken care of. You can always submit comments even if you can't go to a meeting, and join coalitions when you can. If you're like me, you've got so many things coming to your inbox, but it is a really good thing to join some of those so that you can keep up with information. Michelle, did you want to answer the questions with hands up, or did we want to wait till the end?
If we don't mind waiting to the end so we can get through
Okay.
your slides, please.
No problem. Okay. This is the NDSC State Advocacy Engagement Plan. I'm just going to refer you guys to that. You can go to our website, and again, Michelle will send these to you, and you can get all this information. But if you go to our website, we have a section on policy and advocacy, and then there's a section on advocacy and resources, and you'll find all these different things that I'm talking about. I'm not going to go through that because we've kind of talked about it. We have a state advocacy toolkit in the works right now. It should be ready soon, and it will be on our website. So we hope you will look for that. It's going to be a step-by-step kind of beginner look at state and local advocacy. Kelly said if you can only do one thing, I'm going to say the same. If you can only do one thing, sign up for action alerts. Action alerts, NDSC, most of the disability organizations have some sort of action alert system. NDSC, this is a QR code. You can scan that and go sign up right now. We only send out action alerts when it's something really important. So if you get an action alert from us, it's something that you really need to act on soon. Like we did an action alert in the last week just on the situation with the Department of Education. And Heather does a lot of the writing of those, and Heather writes really good background information and helps you know what is going on. And then all you have to do is to sign up, you just put your name and address in, and it'll start sending you the action alerts when we have something. And then when you get that action alert, it will walk you right through what you need to say to your legislator, and you don't even have to look them up. It looks them up for you. Now, the better way is to get to know your legislators, whether they are on the state or the federal or the local level, because when you get to know them, you're going to have a closer relationship. One of the primary way we do this is through the National Down Syndrome Advocacy Coalition, NDAC. And NDAC is our nationwide grassroots advocacy program. We have 1,100 members across the United States, and we have a member in every state. Our long-term goal would be to have a member in every congressional district. And how many you have in California, Kelly? 55?
52.
52. And we do not have one in every district there. So maybe you can help us with that.
Congressional district, then there are 2 senators. So we have 54 people to talk to.
Yeah, so it's a lot, but we do quarterly calls where we do updates on what's going on the federal level. We also always try to have an NDAC member, an individual, talk about something that may be impactful for you or that you can replicate in your state. We have a private Facebook group that you can join and share information and learn from others. But you learn a lot and have access to some extra resources by being a part of this. Joining does not really commit you to have to do anything. I believe that one of the best things we do is educate, but we also we depend on our NDAC members to reach out to these elected officials across the country. We aren't constituents. We can't vote on people except in our own districts and state. So we really depend on our NDAC members to help us with our outreach. And it may be something as simple as this isn't simple, but we have had senators and representatives reach out to us and say, we need this bill passed out of committee, something related to disability. Can you mobilize some of your advocates? And these are the states we need. We're able to utilize and do that through this NDAC network we have across the country. So it's really helpful. Right here it says we have 1,100 members and we have 573 Facebook members. We do not have a self-advocate in every state. I am on a mission to change that. And we have 8 states. So if you know anyone in Alaska, Hawaii, Maine, Montana, New Hampshire, New Mexico, Rhode Island, or Vermont that would like to that's a person with Down syndrome that would like to join up, we would love to have them. We do have members in every state, just not a person with Down syndrome in every state. This just goes through, tells you some of our resources online, so you can see the list of those things. It's under NDSC Advocacy Training and Resources on our website. There are examples of one-pagers. One-pagers are like a bio that someone writes that tells a little bit about themselves and then a little bit about a different laws or bills that we want someone to support or not support, and then asking them to do that. And we encourage people to have those and to keep them updated. And you can use them at all levels. You can use them at the state level, the federal level. Very effective way for self-advocates, especially to get their story across. And then Heather and my daughter did a basic government process video if you want a pretty plain language way to learn about policy. One of the things we're very proud of is we have a policy advocacy toolkit for self-advocates. This is kind of what it looks like. It's bigger than this. In fact, this was Christopher Bennett, who lives there in California, a person with Down syndrome, was one of the people that really helped us to get this going. His family has helped us with the funding to be able to print these, but you can find these on our website too. And it is a great toolkit. And here's a little secret. Even though it's for self-advocate, it's good for anybody that wants to do advocacy. A policy summit, NDSC is going to have a policy summit in Washington, D.C., and that's going to be in the fall of 2026. And we're very excited and be watching in the next month for an announcement about where that's going to be in DC and what the dates are going to be. Follow us on social media. We push out a lot of policy stuff on our NDSC main page, and we would love to have you follow us. And these are our contact information that I hope are all right. Kelly, I think yours is right. I'm going to leave that up for so you all will have that. And then, as I said, Michelle's going to send you these slides. So I did that really fast, I thought.
And our sweet Lily Reamer in here put a description of California's legislative process in our sessions. It's in the chat. It's a 2-year session that goes for 2 years, and they're meeting that whole time. It goes from like January through September, and then I think right now they're still there because they really love each other a lot and they want to spend more time together and make more like decisions together. And then once that's over, then they'll start again in January. So
there you go.
There you go. And thank you, Lily, for
Michelle,
putting that in there. I appreciate your help.
Michelle, do you want to facilitate the questions, or do you want me to call on this person?
I can facilitate it. We actually had a question that was in the chat that I'll start with.
Okay.
So the question is, how have changes that affect the disabled population been allowed to occur? This is a loaded question. If the government is supposed to protect its citizens, do those affected already have a lawsuit filed for violating their rights?
I'm going to let Heather answer that.
There are many lawsuits that have been filed that, NDSC, we don't work in that area, but there are tons of lawsuits being filed, not so much by individuals, although there may be some. As we all know, lawyers are really, really expensive. So a lot of individuals would not be able to do that. But for example, to combat the massive firings in the Department of Education 2 weeks ago, the government workers union that represents all of the people that work in the Department of Education has already filed a lawsuit claiming that it's illegal. The government is not allowed to do that during a shutdown, but they did anyway. So there are tons of lawsuits on various things that are going through the courts. Many of them are making their way up to the Supreme Court. If you're watching closely, unfortunately, though, what we are seeing is that the Supreme Court is just kicking them back down. They're finding some sort of technicality with the lawsuit. And so in a way not to, make any type of, strong decisions on things, they're sending them back. So we are of lawsuits where it goes through the process, goes up to the Supreme Court, then the Supreme Court finds something wrong with the actual suit itself, sends it back down to the lower courts, and then the whole process starts again. So there are a lot of lawsuits, but eventually I think they will make some changes, but right now we're really seeing the runaround.
Thank you. Mary, if you want to go ahead and ask your question, feel free to unmute yourself. And in the meantime, if anybody else has questions, feel free to drop them in the chat or raise your hand as well. Sorry, Mary, go ahead.
Yeah, you hear me?
Yes.
Yeah. Yes, I have a question. they talking about medical IHSS transition or well, they talking about the age, like the age of 14. I don't kind of hear that, but I want to understand that the medical or IHSS change when the kids go through 14, 13, and 14 and up. That's my question. I have a girl, like 8 years old, so it's almost there. So I want to make sure what kind of change in the medical or IHSS.
So I think those are two separate things that we were talking about earlier. One was that we have Medi-Cal, and that's partially what funds the IHSS, the In-Home Supportive Services Program in California. And I think that there was another part of the presentation where we talked about transition, but I don't think that, I think that the concern is that something might change and then you might not have access to IHSS once your daughter is 14 or 15. Those are unrelated ideas. So those two things don't connect unless there's something I don't know about. But the IHSS and Medi-Cal are just connected because they're both funded partially with Medicaid money. So as there are cuts, there could be cuts in the future to both Medi-Cal and to IHSS. But as far as I know, they're not age related or transition related. They're just everything's going to be cut because there's such an incredibly huge cut coming. I hope that helps, Mary.
Yeah. So it's not related to the age. So
No,
when
ma'am.
my daughter is 13, 14, and um everything stay the same, like they're going to the same, like nothing change.
Well, at this point, today that is accurate, but my daughter is 13. She still has access to Medi-Cal and through the institutional deeming waiver and to IHSS. Then that's a support that we have, and regional center services and her IEP. Those don't change because of her age. They're not related to her age.
Okay,
She
I'm saying because when he's older, like I think I hear I'll get the information when he's the 21, with the kids with Down syndrome is change, so everything change. So
Really?
when I hear 13, 14, I'm like, hold on, I don't prepare for that. So this is why my
Yeah,
question.
I don't think
I-
that's the thing. And go ahead, Jawanda.
I think, Heather, you said something about the use of the word transition being taken out.
Oh, okay.
I
Maybe
think
that created
that's
some
what she's
confusion.
talking about, because that's a school, that's part of
It's part of
education.
IDEA.
Yeah,
Individuals
that's
with
part of
Disabilities
IDEA.
Education Act. When they talk about transition or transitioning youth, that typically starts at age 14 and goes till 21, or some states 22, when they exit the school system. So maybe that's what the confusion was about.
It's not related to your medical services. It's related to school services.
Okay, perfect. Thank you. Thank you for the answer.
And Willie commented, and this might be what it was. There was one slide, Heather, that had mentioned like the 80-hour work requirement that had the age of 14. I wonder if that could have been what it was referring to with the 14-year age.
That could be Michelle, but my follow-up with the DCHS letter to like clarify the difference between our institutional deeming waiver and the expansion, like, or the regular Medi-Cal qualification. Hopefully that's also in that same area. So if you have an institutional deeming waiver, regardless of the age of the person who is institutionally deemed, right, and we're waiving those services, the age is irrelevant and there's no work requirement on that DD waiver.
Okay, perfect.
Heather, you might have something more to
Yeah,
add.
and just to clarify, on Lily's question, it says, is the question if the parent would need to do 80 hours of work when the child with Down syndrome becomes 14. So that's only if the parent, if the family is on Medicaid. So in many situations, it's, just the child receiving Medicaid services. And obviously a 14-year-old child is not going to have to, do 80 hours a week. As I said, to most people with Down syndrome are in Medicaid through that traditional disability pathway anyway, so it wouldn't apply to them. But if the family itself is separate, is on Medicaid, so low income, there is some confusion, and hopefully the federal government will clarify this as to when the child becomes 14 or even 18, the age of legal age of majority, but the parent is still the primary caregiver for that young adult, whether or not that parent who's also on Medicaid would have to work 80 hours a week in order to maintain the parent's Medicaid.
My friend, 80 hours a month.
I'm sorry, 80 hours a month. Thank you. I may be working 80 hours a week these days.
Just wanted to get those time frames under
Nope,
control there.
absolutely correct.
Yeah.
80 hours a month.
This was so much information, and I've heard this all at NDSC because I attended so many, but this is still so overwhelming and so much information. And I think the best way to stay in touch with all of these and all these new developments is to join NDAC, correct? And to stay up to date with what you guys are doing and how we as parents can advocate from the state level.
Yes, and Michelle, I put those links in the chat to join
Perfect.
NDAC, but we're gonna, I will, as soon as we're done, I'm gonna send this presentation to Michelle in PDF format. You should still be able to access all the links. If you can't, and you can't remember our names, you can email us at policy@ndsccenter.org, and those come to Heather and I, and we can take care of you. You can go to our website and try to navigate that. But it was a great advertisement, Michelle, and I didn't even tell you to do that.
I'll send my bill in a bit.
And our next NDAC, remember Juwanda said we do quarterly calls. So our next call is actually coming up November 12th. So, now's a great time to join if you're going to. It's obviously after Election Day. And while, the elections are, it's kind of a minor election year, it's still going to be really significant in terms of governorships and state legislatures, particularly with a lot of the gerrymandering efforts going on. So we will certainly talk about the implications of whatever the election results are. And then we're also going to give a policy update on, basically what's going on with everything, but with a particular focus, of course, on education.
And I don't know if you guys mentioned this, but it is free to join NDAC. So
Oh,
there are
yes.
no, so if everyone
Also,
can join.
Just to jump on to the education focus on that, a lot of people are doing webinars right now in California on that alternate pathway to diploma. It seems to be really common in a big area of question. So if that's something you're thinking about, the undivided group I was telling you about earlier, they're going to be having California Down Syndrome Advocacy Coalition is going to co-sponsor that webinar that's coming up. That'll be Kristen Wright and another person who used to be at the state level with special education, whose name has escaped me, but it's coming up soon. And as soon as I see it, Michelle, I'd be happy to send it to you if
Yes,
you don't
please,
already
if
have
you don't
access to
mind.
that.
No, I
problem.
haven't heard of it. So yeah, if you don't mind, then I can
Happy
send it
to.
out to everybody. Thank you.
And
course.
Michelle, just an added thing, NDAC members, we do offer a few value added things. They're all free, okay? But one of those is something called Education Policy Deep Dives. And some of you may know Ricky Sabia. She's our senior education advisor. And I knew Ricky since Rachel was really young, and I'm eternally grateful, I say, to Ricky because she really helped me with laws and stuff. But she represents families of children with disabilities and intellectual disabilities, and often is the only one at the table on some of the task force and different things that are going on. She's very much an expert on education policy, and we offer deep dives. We try to do one a quarter where we delve into some of these deeper topics, like when Kelly said the alternate assessment, it made me think of that. She's done one on assistive technology, but she's also done one on the 1% cap and IQ testing and some different things like that. But that is something we reserve for NDAC members only. So just another benefit.
And then just to, I know we're closing out, but also I don't think we had a slide on it, but wanted to put in a plug for the NDSC annual convention. It will be July, what is it,
23rd through 26th.
Thank you. 23rd to the 26th, 2026, next summer in Orlando. Registration will be opening in March. There's already a call for speaker proposals open. So if any of you are interested in speaking at the general convention or, to the youth and adults conference, please go ahead and put in your proposal. And as always, Jawanda and myself and the rest of our policy team will be doing an advocacy training boot camp, which is really a half day of, very intensive advocacy training. We'll talk about the one pager that Jawanda discussed. And, if you're going to come to convention, it's free. It's, not an additional add-on, and we hope to see many of you there.
It's a very, very, very informative boot camp. Overwhelming, but informative.
Thank you, Michelle.
Thank you. It doesn't look like we have any more questions. And so for everybody, the presentations and the recording of this will be available soon. But if you have any questions, don't forget to reach out to them. Their contact information will be on all of the slides or on the slides, and I'll also include it in an email. But thank you so much, ladies. This was fantastic. And I know this is ever evolving. And we'll be keeping an eye out to see what more we can do as parents to keep everything alive for our kids.
And Michelle, thank you for championing policy. We appreciate your giving leadership to that.
Thank you. I'm just the microphone for you guys. I'm just bringing you guys because you guys are the experts, and I'm the mom that's completely lost in all of this. So I appreciate you guys bringing all of this to light for us.
It's our pleasure.
Thank you, ladies. Hope everyone has a great day, and thank you for joining us.
Thank you.
Bye-bye.